Black Friday could be affecting how your brain is wired. Psychologists say the feel-good chemicals in your brain may set you up to spend more. Doctors say our brains make things automatic, but that can be dangerous when it comes to shopping. The brain lightens up, turning off the part that thinks things through. The best advice, just take a breather before that big purchase and make a budget before rushing to stores. Like easier said than done. Well, the cold weather and snow in northern New England allowed the region's largest ski resorts to open already. Thanksgiving week is often thought of as a kick-off to the busiest part of the season, and doctors are out with findings from a new study into the safety of skiing and riding. Jack Thurston reports.
They protect against things that are completely preventable.
Dr. Leah Porter and her colleagues at Dartmouth-Hitchcock's Trauma Center are big proponents of helmet use on the slopes, saying they can provide a critical buffer against skull fractures and certain spinal injuries. But the team reminds skiers and riders that gear doesn't make them invincible.
Just like a seatbelt, helmets have limitations.
Looking at more than 700 injured skiers and riders brought to DHMC over 8 years, the trauma physicians found many of those in helmets still suffered severe injuries, including internal bleeding in the head. Nationally, while ski deaths are even rarer than fatal lightning strikes, more than half of people killed are in helmets. So the Dartmouth study has two main takeaways. First, just because you're helmeted doesn't mean you don't have to be evaluated by a professional after a bad bumper crash. And second, know your limits and control your speed.
You should wear a helmet, but you also need to ski within your abilities.
The industry has really made safety a focus, saying more than 80% of skiers and riders today wear helmets, compared to just a quarter or so at the beginning of the millennium. Ski patrol directors like Sean Grisb at the Middlebury College Snow Bowl push protection too.
It may be the difference between a mild concussion and no concussion.
Back at the hospital,
Skiing is incredibly safe.
Dr. Porter knows there's a bonus to helmet use not covered in her study. They help keep you warm.
While Americans are having fewer babies, the Centers for Disease Control and Prevention says the number of births dropped by 2% last year. That's the fourth consecutive year of decline. The fertility rate in the U.S. also reached an all-time low in 2018. According to a separate report published by the National Center for Health Statistics in July, the fertility rate is below what's needed for America to replace its population. Just in time for the holidays, the CDC says flu season is peaking early. 38 states have already reported flu activity. In today's Health Minute, Reed Binion explains why it's not too late to be prepared.
With flu season picking up steam, experts suggest now is the time to act.
There's still plenty of time to get vaccinated and for your body to build up immunity before the season's going to sort of get into top gear.
Taking proper precautions is about more than keeping yourself safe.
You're actually less likely to spread the virus if you're vaccinated.
Especially around the holidays.
We're all moving, we're visiting friends, families.
People at a higher risk for the flu include those with compromised lungs and people from both ends of the age spectrum.
The elderly in the community, so whose immune systems perhaps aren't as robust as they used to be. Very young children whose immune system haven't really built up immunity to flu yet, those guys are particularly susceptible.
Besides getting the flu shot, there are other simple steps you can take to protect yourself and the people around you. Wash your hands regularly, cover your mouth and nose when you cough or sneeze, and stay home when you are not feeling well. For today's Health Minute, I'm Reed Binion.